On behalf of my colleague from Mississauga-Centre, MPP Natalia Kusendova, and myself, we want to sincerely thank everyone for being here today. You know, life's challenges can be very difficult, and when those challenges include the health of a loved one, it gets more complicated. And it can almost feel like they were drowning when you're dealing with a family member who's dealing with dementia. Approximately 250,000 Ontarians face this challenge with dementia, and an estimated 400,000 will be affected by the year 2030. It is with great pleasure that we announce the tabling of my first private member's bill, along with my colleague, MPP Natalia Kusendova, Improving Dementia Care in Ontario Act 2023. So, not so long ago, I was faced with this challenge, not just once, but twice, simultaneously, with two separate family members. And as a primary care provider, we want to do everything in our power to care for our loved ones. And I know this through lived experience. Like many, as a member of the sandwich generation, I was constantly battling the day, wondering if I was going to be able to care for my children as a wife and a mother and a business owner while facing the issues of Alzheimer's and dementia with my two very close family members. People in this position are challenged, and the circumstances can be very difficult. Physically, there were days I didn't know if I was going to be able to get through it, to ensure that everybody had the level of care that they needed in a way that was provided with dignity and love. So they need to have the resources at that time, but they have to be done in a way that's thoughtful for everyone. And I'm now going to pass the microphone over to my colleague, MPP Kusendova.
Well, thank you so much, MPP Smith, and I'm truly honored to be here with you today. And good afternoon, everyone. I want to thank everyone for joining us on this special day as MPP Smith and I hope to start a meaningful conversation about how we can provide better care for seniors and those living with Alzheimer's disease and related dementias. 250,000 people in this province are now living with dementia, with countless families suffering. And this is precisely why we are taking action. My colleague MPP Smith and I have proposed this private member's bill so our province can support improved access to dementia care and better equip healthcare providers with the best knowledge, skills, and training for providing person-centered dementia care. As a nurse and a legislator, I understand many of the challenges that come with caring for patients with dementia and how we need to provide a pathway and a framework to support patients, caregivers, and care providers like personal support workers on their dementia journey. If passed, this bill will provide a provincial framework designed to support improved access to dementia care so that patients can navigate through their dementia journey with a clear path by destigmatizing the diagnosis and providing adequate training for PSWs and caregivers who are equipped with the knowledge and understand the challenges that come with caring for a dementia patient. S'il est adopté, ce projet de loi fournira un cadre provincial conçu pour soutenir l'amélioration de l'accès aux soins de la démence, afin que les patients puissent naviguer dans leur parcours de démence avec un chemin clair, en déstigmatisant les diagnostics et en fournissant une formation adéquate pour les PSSP et les soignants qui sont équipés avec les connaissances et comprennent les défis qui viennent avec la prise en charge d'un patient atteint de démence. This is also why, if passed, this bill calls on the Ministry of Colleges and Universities to review its personal support worker standard to better equip healthcare providers with the best knowledge, skills, and training for providing person-centered dementia care. We are also calling on the Ministry of Health to develop a provincial framework designed to examine the current state of care, programs, and resources available to persons living with dementia, as well as identify dementia research and common data elements. If passed, this will support improved access to dementia care and support patients in navigating through their diagnosis and treatment. Because resources exist, such as the over $500,000 investment our government made last year to expand the Finding Your Way program through dementia-friendly communities so that those living with dementia can be included in all aspects of community life. Cette ressource aide les personnes atteintes de démence, leurs familles, leurs soignants et les communautés à reconnaître les risques de disparition, à se préparer aux incidents de disparition et à faire en sorte que les personnes atteintes de démence puissent vivre en toute sécurité dans la communauté. This resource helps people living with dementia, their families, caregivers, and communities to recognize the risks of going missing, be prepared for incidents of going missing, and ensure that those with dementia can live safely in our communities across Ontario. The Medic Alert Safely Home program exists as well, which provides support for families and caregivers, people with dementia who are lost, and members of the community who find them. Because over time, a person living with dementia may have trouble solving problems, communicating, and recognizing their surroundings. And as a result, they are at risk of becoming lost, even in familiar places. With these resources available, it is important our government provides a framework to help dementia patients, caregivers, and care providers navigate this often challenging diagnosis. And that is why this private member's bill, and that is what this private member's bill is all about. We must prioritize support and advocacy to improve the quality of life for those living with dementia, their care providers, and caregivers. By increasing public awareness and enhancing support, we can strive towards a more inclusive province to ensure dignity, compassion, and meaningful support is available for those impacted by this difficult diagnosis. Thank you, merci. And now I return it back to MPP Smith to talk about the First Link program.
Thank you very much, MPP Kusendova. You know, you touched on so many important issues, including the family members. And those who face those challenges can feel like they are literally drowning. They are slowly going down and they don't know where to turn. The goal of this bill is to raise awareness and foster a discussion on the care of Alzheimer's dementia. The silver wave is definitely upon us, and with the aging population, it affects so many individuals and so many families. This is a conversation that should happen. And the Ontario Alzheimer's Society resources have been phenomenal partners, and we want to call up First Link and the referral program because it is such an integral part of the system. They provide support and expertise programs and services within our communities. First Link also helps provide people with information on how to recognize Alzheimer's dementia and assist clients and family members as they navigate that very difficult journey and challenge. Some of their services include one-on-one or group support, and they connect people to local care facilities. They also allow individuals and their families who suffer from dementia and Alzheimer's to network with other families, which is such an important tool. I can remember back to just a few years ago when I was dealing with this very difficult issue, and being able to speak to somebody in a similar situation can sometimes make all the difference in the world. I'm now going to pass the mic back over to Natalia.
Thank you, MPP Smith. And we have some incredible individuals standing behind us today and also in the room. You know, when MPP Smith and I embarked on this journey a year ago, we've consulted and we've met with so many incredible people and organizations and stakeholders who are doing revolutionary work in this field. And today wouldn't have been possible without their support and their advice. And so without further ado, I would like to welcome Kathy Barrick, representing the Alzheimer's Society of Ontario, to speak about the important work that the Alzheimer's Society is doing, but also how this bill will help those living with dementia.
Good afternoon. Thank you so much. As mentioned, I'm Kathy Barrick, and I'm the CEO of the Alzheimer's Society of Ontario. The proposed Improving Dementia Care Act in Ontario Act has the potential to make a real and meaningful difference in the lives of Ontarians living with dementia, their care partners, and their families. On behalf of the Alzheimer's Societies in Ontario, we offer our thanks to MPPs Kusendova and Smith for their leadership in this area and for their ongoing advocacy on behalf of their constituents living with dementia. Dementia lies at the heart of many issues affecting health and long-term care in Ontario today. There are over 275,000 Ontarians living with dementia, and more than that number serving as unpaid family care partners. Both of these numbers will triple within 30 years, by which time well over 1.5 million Ontarians will either be living with dementia or caring for someone who is. The World Health Organization has identified dementia as a public health priority and has said that dementia strategies are a powerful tool for improving care. The act being proposed today would bring Ontario in line with other provinces and nations that have embraced the WHO's call to action by creating a Made in Ontario dementia framework. This framework, we hope, will lead to tangible outcomes that keep Ontarians living with dementia out of hospitals and where they want to be, at home. We call on all parties to support this legislation and on the government to both embrace the creation of Ontario's new dementia framework and fully fund its implementation. Thank you, and I will now turn the podium to my colleague, Carrie Quinn Humphrey, who's the CEO of the Alzheimer Society, York Region. Thank you.
Thank you, Kathy.
Thank you. Good afternoon. Thank you for joining us today. My name is Carrie Quinn Humphrey, CEO of the Alzheimer Society of York Region. I was pleased to be invited to speak today. York Region is lucky to have a dedicated champion for residents living with dementia and their care partners in MPP Laura Smith. There are over 21,000 people living with dementia across York Region, a figure that will double within a decade. Despite our proximity to Toronto, clients in York can face a very different experience in receiving dementia care. Wait times for a diagnosis often exceed a year, and the same is true for accessing many of our services and supports. Dementia is a progressive condition, and the supports people living with dementia and their care partners receive must evolve with the disease. That isn't happening today. More often than not, people receive tomorrow the level of support they needed yesterday. This lack of health systems planning, which will only get worse as hundreds of thousands of Ontarians develop dementia in the coming decades, leads to unnecessary suffering for people and unnecessary strain on our hospitals and long-term care homes. Meeting people where they are, with the care that they need and where they need it, lies in the heart of person-centered care. I am so pleased to see the dignity and independence of people living with dementia prioritized in the Improving Dementia Care in Ontario Act, and join with my colleagues across the province in calling for its passage into law. And now I'd like to turn the podium back over to MPP Smith.
Thank you so much, both Kathy and Carrie. We truly appreciate your partnership. I would like to invite the Ontario Brain Institute Representative Krista Studzinski to make a statement on dementia in Ontario.
Thank you, MPP Smith. So on behalf of the Ontario Brain Institute and the broader brain health community, we applaud both MPP Smith and MPP Kusendova for their leadership and for championing an act to improve dementia care at the Ontario Legislature. Our partners here have already highlighted the need. As an organization, the Ontario Brain Institute helps advance brain health solutions so that Ontarians can access care in the community where they're living and where they're receiving care for their brain disorders. Part of the programs that we offer range from research, informatics platform. We also offer some commercialization supports and working with our patient advocacy group partners. The idea here is working to develop the evidence base so that we can show that certain technologies and programs and services can have a meaningful impact on brain health. Now more than ever, with the highlighted need of over 275,000 Ontarians living with dementia, we need to come together as a community to meet the needs of Ontarians by helping them access timely diagnosis, community supports, and new and innovative treatments for dementia. Thank you both for your leadership. We look forward to working with you and partners such as the Alzheimer Societies, Sheridan College, and Redispect to make this to make your vision a reality and improve the brain health of all Ontarians.
Thank you so much, Krista. And now I'd like to invite a stakeholder that is in my riding. We have the famous Hazel McCallan campus of the Sheridan College, and I'm so proud to have their representative here. And just to speak specifically to the second part of the bill, which speaks to education. You know, for me as a nurse, I work with our PSWs in a partnership all the time. And what they tell me is that sometimes they don't feel adequately prepared for the realities of working in long-term care or even in the emergency room. Because the truth is that in long-term care, for example, over 80% of patients have a dementia diagnosis. So that is why that second portion of the bill, which will be looking at the PSW curricula to ensure that person-centered dementia care is included, is so vital to our retention success of PSW. So without further ado, Mr. Michael O'Leary, representing Sheridan College.
Thank you very much. Thank you very much, MPP Smith and Kusendova, for introducing this bill. We at Sheridan College are thrilled to see this coming to light. Also, MPP Smith, thank you very much for sharing your story. I know that in preparing the highest quality PSWs to enter into practice, as an academic institution, we are looking forward to seeing a framework built that will support those basic skills as well as those advanced skills that they are going to need to navigate those complex situations. It's been said already today that the Ontario population is going to age. We are going to see more elderly individuals. We're going to see more cases of dementia. And having a framework within the academic sector allows us to better prepare our PSWs, our PNs, our RNs, in order to have them go in to provide the care that individuals need both in the community as well as in long-term care, and to keep, as it's been mentioned, individuals in home where they want to live, where they want to be longer. So we are thrilled to be here. Thank you very much for introducing this bill. Thank you very much for all those who have supported it, and it's an honor to be on the stage with all of you today. Thank you.
Thank you. Thank you. I truly want to thank you for your pointing out. It takes a village, and I think that this is a very important conversation that we have to continue to have. I believe our last speaker is going to be ReadySpec Representative Catherine Bornbaum to make a statement about the need for supporting dementia patients. Thank you.
Thank you very much to MPP Smith and MPP Kusendova for the opportunity to be here today to speak to you. I'd like to begin just by acknowledging how significant we believe this bill is. We have had the opportunity at ReadySpec to learn from models all around the world and to see different strategies being implemented in different frameworks. And I think that Ontario moving forward with a structured framework that can guide a formal strategy here for dementia care is a critical first step, and we're delighted to be a part of that conversation and planning. I'm here to represent ReadySpec, which is an Ontario-based company that is enabling early, accurate, and widespread detection of neurodegenerative disease markers using an affordable AI-based eye scan. And so we know at ReadySpec that early detection of dementia is a critical first step to ensuring health system preparedness. But we know that it's not the only important step. It is just the very beginning, and we believe that a structured framework that is informed by critical stakeholders who understand what it means to be a caregiver, to be a healthcare provider, and to support those throughout the continuum of care and their dementia experience is absolutely vital. So we are delighted that this bill is informed by all of these various stakeholders. Together with many partners on the stage here today, ReadySpec has been fortunate to take part in an initiative where we are assessing our technology in community-based settings, including optometry, and in collaboration with the Alzheimer Society of Ontario and Toronto, where we're able to assess the use of new technologies to enable affordable and widespread screening as a first step. And so we're very excited to see how findings such as this, new technologies, new Ontario-based companies, how we may be able to contribute to the future of Ontario's dementia strategy. So thank you very much, MPP Smith and MPP Kusendova. We are delighted to support all of your efforts going forward, and we look forward to a much brighter future thanks to this first step.
Thank you. Thank you.
Thank you very much. We also wanted to thank the Ontario Retirement Communities Association for attending with us today, as well as for providing a letter of support of our private members bill. And I believe at this time we are ready to take some questions, if there are any.
Curious to know, you mentioned other provinces and Ontario possibly being late on progress on the other provinces. Can you develop a little bit on that, and why are we not more up to date?
Thank you for the question. This is sincerely about getting a conversation going because we don't want to fall behind. And the discussions about Alzheimer's dementia is so important because the silver wave is upon us and it affects so many families, whether you're in Ontario or in BC. This is a conversation that has to happen, and our goal is to get more information so that we can better provide for our communities, our seniors, our loved ones, and our family members.
How are we late on other provinces? Maybe I missed that part.
So our bill is about providing a framework for patients when they're accessing care. A lot of patients don't have a streamlined process to enter. And that's what we've been hearing from various stakeholders. And so that is why we're introducing this private members bill to call on the province to provide a framework so that patients accessing services across different communities in Ontario, and we know how variable our communities are, have a clear pathway from a diagnosis to treatment, to support, but furthermore to also have support for their families and care providers. You know, MPP Smith talked about her journey as someone who was both taking care of young children and elderly parents with dementia. And so we want to ensure that patients are supported, their families are supported, but further to that, our PSWs, for example, who play an integral part of the interdisciplinary team, also have the tools and resources that they need when they are taking care of persons with dementia. For example, one strategy is the GPA strategy, gentle persuasive approaches. We want to ensure that strategies like that are looked at when we develop curriculums at our colleges, which the government is funding, to ensure that once PSWs graduate, they are well equipped to enter the workforce so that we also retain these PSWs, because what we know is some of them quit and we want them to actually stay in the profession. So that's what this PMB is about.
And if I may, if the need for this bill is so urgent, why now? Why not 3-4 years ago?
I can speak to that. So because I've been a legislator for 5 years, you know, we had in the last session in the 42nd Parliament, we had something called COVID, and it was we were dealing with that, and you know, all of our ministries were hands on deck dealing with the pandemic. But now that we have even a bigger majority than last time, it is the perfect time to start this conversation on dementia, to put all the pieces, because pieces of the puzzle are already there, whether it's First Link, whether it's Finding Your Way program, the pieces of the puzzle are there. But what we want to do is through consultation with our stakeholders and by traveling this PMB across the province and hearing from the different communities out there what they need. For example, there's a hospital, Brantford Brant, that has a dementia specialist embedded in the ER. So we want to assess, is this the best care practice that we could bring and use that model in Brantford Brant that works so well for their community? Can we use that model and apply it in other areas of the province? So this is why this bill is so important, to put all the pieces of the puzzle together and provide that streamlined access for patients and families. But furthermore to that, we want to destigmatize dementia, because so many people are scared of the diagnosis, right? And sometimes doctors don't even diagnose the disease. And so by talking about it and by talking about the availability of resources and building on the resources that are already out there, we want to destigmatize dementia so that people can come forward. Because as we know, if we get early treatment, you know, the results can be, the patient outcomes can be a lot better. So this is really the essence of this bill, is starting the conversation and destigmatizing dementia.
And if I could just add to that, you know, First Link has actually been in existence since 2017. I was still caring for a family member in 2017. The reason why I did not know about First Link was simply an awareness issue, and this is so key. And the magic of First Link is that it doesn't matter whether you're in the GTA or Northern Ontario. It provides you with a connection to care, which is so important. When you feel you're drowning, when you have that family member that can't get that type of assistance, it's very, very important that people know that these services are available.
I have more questions.
No.
I mean, we did say one question.
Yeah. But if there's time after.
How are our
What time is it?
We can take one last
One
question.
last.
Yes.
About French services.
I knew it was coming. I knew it.
Yeah, just I'm assuming you already know.
Oui, alors, oui, ce projet de loi est très important pour les personnes qui atteignent de la démence, les patients. Alors, on va évaluer les programmes qui existent déjà, mais on veut commencer la conversation. Alors, on veut voyager avec ce projet de loi dans différentes communautés, y compris les communautés francophones, pour évaluer les programmes qui existent déjà et comment on peut meilleur soutenir les francophones. On sait qu'on n'a pas assez de soutien pour les francophones, on le sait déjà, mais on veut commencer ces consultations. Et ce vendredi, je vais parler avec la région de York, car ils ont des programmes pour les francophones. Alors, je veux apprendre ce modèle, comment ça sert pour la démence, exactement, pour qu'on peut prendre les meilleures pratiques et voir si on peut les appliquer dans d'autres régions francophones de notre province. Merci. Thank you. So, yeah. So I would like to thank everyone for attending today. We're truly excited, and MPP Smith and I, we're starting this journey, and we wanted to actually invite everyone to our Lunch and Learn. It's called Destigmatizing Dementia Lunch and Learn, and it is taking place on June the 16th. It will be at the Alzheimer Society of Peel on June 16th. A lot of our stakeholders that are here will be present there. And really the idea behind this Lunch and Learn is to get seniors living in our communities, their families, as well as experts, researchers, people providing services to seniors to be in the same room so they can have a conversation, to network, and so to build those supports and communities. We're starting in my community of Peel, but we're hoping to bring this Destigmatizing Dementia Lunch and Learn to other communities, definitely York, but also others. And so, yes, we invite you all to please come and participate, have some lunch, and also learn something about destigmatizing dementia.
Thank you so much, MPP Kusendova. Yes, destigmatizing dementia. This is a huge issue. It's a conversation that we have to do this because this is something that I faced, and we don't really have a choice. I think this is important that we start this communication going, and we're so excited about going to different locations in Ontario and talking to people about this very important issue. On behalf of Natalia Kusendova and myself, we really want to thank you for being here today, and all of our partners.
Yes, the Alzheimer Society of Ontario, the Alzheimer Society of Peel and York, Ontario Brain Institute, Ontario Retirement Communities Association, Retispec, Sheridan College, and many more partners. Thank you. Merci beaucoup.
Merci. Thank you.
Yeah.